It's 2025, a time for global progress, yet for millions, mental health remains an invisible battle. With one voice calling for urgent changes on World Mental Health Day, philanthropist and chairperson of the Aditya Birla Education Trust, Neerja Birla.
The stigma around mental health was just so much that one didn't even know where to go for help. And I realized that, it was just around everywhere, but people were just not talking about it. And they feel that it's not a safe space to sort of talk about it. And, there's not, the supportive ecosystem is lacking. They're always scared that if they talk about it, they're going to be judged.
From fear to silence, the barriers are many. And for those outside big cities, the help is even harder to find.
Mental health care is not that accessible, even more so in rural country, in the rural part of our country. And that also adds to the stigma, because then you're sort of hesitant to seek help, you don't know where to seek help, and that really aggravates the problem.
Women especially face the brunt, often juggling economic hardship, social pressure, and emotional neglect. Even as conversations about mental health grow louder, the system remains underfunded. Experts say India spends less than 1% of its health budget on mental health, and this needs to be addressed urgently.
One doesn't even realize that you could be suffering from a mental health concern, and because it is so stigmatized, a lot of times it's looked at, that it is just a problem, you need to just deal with it, and especially more with women. I think, I think with women, self-care is just at the bottom of the pyramid, and one is just expected to just show up no matter what because of all the multiple roles that you're playing. So you're often not even realizing that you're going through a mental health concern.
What's also ringing alarms in today's digital age is another invisible trigger which looms large: social media.
I think public and private partnership is what we need to work at. And I think if we're able to bring about policy change, like for example, if we are to make mental health learning mandatory in schools and embedded in the curriculum, that itself will be a huge changer, because then you're bringing up children and teaching them about mental health concerns, how to identify them, giving them better coping mechanisms, how do you teach resilience.
Neerja Birla's message this World Mental Health Day is clear, that from classrooms to clinics, from social media to society, the journey to better mental health begins with one step: talking about it. Bureau Report, Business Today TV.